So share your problems with regard to listening. Share your problems. Yes. Right. Time management and spelling. Hello and welcome to Seven Sentinels. This is Grandmaster class and I am Peter Simon with you. Today we are conducting a special session. This is a demo session. We'll be learning the tips and tricks and techniques for listening and reading. Yes. So time management is one problem. Spelling is one problem. Okay, which is the most difficult for you? Which section or which part? A, B, C. The most difficult. Which part? A, B, C is the most difficult. So we'll decide based on your poll. Now reading or listening. Choice is yours. Select one option. Please. Reading or listening. Yeah. So Dr. Wasiur Rahman, Hina, Kale, then M. Yeah, M. Write down your first and second names, please. Write down your first and second names, please. Yeah. We'll take your choice. So, one reading, 3 listening. So, 3 listening and 1 reading. What about the rest? Yeah. So, 2 reading and 3 listening so far. Your poll. Right. So, Kale, see. So, first select listening or reading the other candidates. So, majority listening. So, 3 listening, Hina reading, and Simran reading. Ipsa reading. So, 3 reading and 3 listening. So, 6 members, 2 more are remaining. So, you can give your voting, listening or reading. So, both are equal now. Yeah. Yes. So, we are going for the listening test. So, first we are going for the listening test because both are same. So, we are going for the listening test first. Yes. Now, in listening, part A or B or C, any one you can select. We have selected for listening and we'll, yes, part A, B, and C. So, Simran count the number of C's and Kale count the number of B's. Nobody wants A. Right. C3 and B 1. Okay. So listening C. Listening part C. Listening part C. Fine. Right. There we go now. Right. So Dr. Jake Cooper. Dr. Jake Cooper. Right. Hidradenitis suppurativa. Suppurativa. The pronunciation. So this is a medical and specialized term. Suppurate, suppurativa, to form or give out a thick yellow liquid because of infection, sore, suppurating sore or wound, skin infection. Okay. Yes. So right, here we have 2 pages. Yeah, we have 6 questions here. Right, go through the yes. Go through the questions. Give me a second. So this is the topic for us today. And if I give you some techniques, note them down. Hidradenitis or hydradenitis suppurativa by Dr. Jake Cooper. The listening part. Go through the questions. You hear a dermatologist called Dr. Jake Cooper talking about a skin condition called hidradenitis suppurativa. You have now 90 seconds to read questions 37 to 40. Now here there are 90 seconds. You have 90 seconds at your disposal. 90 seconds. And here you have to read the questions 37 to 42. Now if we analyze this point, if you analyze this point, right. Now you have 90 seconds. 90 seconds. And 90 seconds and the number of questions, so 6 questions. So each question you have 15 seconds to go through. 15 seconds to go through. Yeah. So for each question 15 seconds. Each question 15 seconds. That's it. So you have to think about this point here. Now 15 seconds for each question. So you take so now let us think about this. Right. Now this is the stem and these are the branches. This is the stem and these are the branches. So we have 1, 2, 3, 4. 1, 2, 3, 4. So that means spend 15 seconds for these 4 things. Now, so 3 seconds, 3 seconds, 3 seconds, 3 seconds, 12 seconds. 12 seconds. Then 3 more seconds you have. So they will be for store. So that whichever difficult things you can add. For example, any one particular thing is difficult, you can add those 3 seconds there. So that is how you can manage. Right. So let us take the first question. Let us take the first question. How we are analyzing the question. Afterwards, we'll listen to the questions and we'll try to understand. But we'll try to analyze the question very carefully. So we have 6 questions in all. 6 questions in all. Right. So here is the question. So let us study this question carefully. Take 15 seconds. You study this question. This is called skimming and scanning. So only the regular students will be welcome, and those who are repeatedly attending the session, they will not be allowed. So those who have attended the sessions number of times and they are attending the sessions freely, they will not be entertained. Yeah. So those who are registered, they can attend the session. Those who are guests for the first time or second time, they will be permitted. Sorry. You can even write down this question in your notebook. And you can mark, line, underline, highlight, circle, draw arrows, whatever you want, you do. I'm giving you 1 minute, no problem. Actually 15 seconds, but I'm giving you 1 minute. Because this technique you will be applying everywhere. Pooja Kesari, you are welcome. Yes, 30 seconds more. Yes. Now we are moving further. When describing the condition known as HS, Dr. Cooper suggests that it means HS. Okay. Hydrogenitis suppurativa. It is common. It's a common condition. Okay. It is a common condition. Number one. Okay. Therefore, should be more accurately diagnosed. So diagnosis is easy. So common for diagnosis. It is very common. It's very common. So diagnosis is not difficult. So should be more accurately diagnosed. This is related to diagnosis. So common condition. So the condition is common. Number one. So it would be better understood. It would be better understood. So understanding the condition. Understanding the condition. If presented more uniformly. So uniform presentation. Presented more uniformly. Right. It may be incorrectly treated. So treatment due to misinformation from patients. Right. So try to understand these parts which I am going to show you now. When describing the condition known as HS, Dr. Cooper suggests that it is fairly common. It would be better understood because it is not understood properly, so it is better understood. The condition is better, will be better understood, but it is not better understood. So that it would be better understood. So now not understood properly. So try to understand there is a relation between A and B. There is a relation between A and B. Because if it is present more uniformly, uniform means common. More uniformly means less common. Try to understand the relationship between A and B. Is fairly common. Common would be better understood if it is presented more uniformly. Would be better understood if it is presented more uniformly. It is missing there. That's okay. That means it is not better understood because it is not presented more uniformly. So try to understand the point. The opposite of the sentence B. Uniform means common. Uniform means common. The students in a school wear a uniform. That means they wear a common dress. Try to understand the relationship between A and B. B is the opposite of A. Can you identify that? First one is fairly common. Uniform, normal, usual, regular, general. Write down the synonyms. Write down the synonyms. Is fairly common. Common, normal, general, usual, regular. So diagnosis is easy. Second one is, it is less uniform. That means less common. That is why less understood. It is less understood because it is less common. Uniform means common. Understood means diagnosis. Understand. If you understand, you can diagnose it. If you are diagnosing, that means you can understand it. Common means uniform. Common means uniform. Diagnosis means understanding. If you understand only, you can diagnose. No, if you don't understand, how can you diagnose it? If you don't understand, how can you judge it? How can you decide on it? How can you diagnose it? How can you assess it? How can you evaluate it? Evaluation, assessment depends on understanding. Okay. That's the point there. That is the point there. So A, common, so it can be understood perfectly. More accurately means perfectly understood. That's why diagnosed. The doctors understand it, so they diagnose it. It is common, so the doctors can more accurately understand it. So that's why they diagnose it. That's it. They can diagnose easily because it is common. B, reverse order they gave. It is less common. It is less common. So it is not understood properly. So if it is more common, then they can understand. That means it is not common. They cannot understand. That's why they cannot diagnose. So first one is easy to diagnose because it is common. Second one is difficult to diagnose or difficult to understand because it is less common, not uniform. Then C, may be incorrectly treated due to misinformation from patients. First one is for the doctor, second one is for the doctors, but third one is depending on the. So here the patient's role is important. First one is common, second one is uncommon, third one is information from the patients. Okay. First one, doctors depending on the common things, so it is easy to diagnose. Second one, it is not common, so it is difficult to diagnose. So that's why it would be better understood if it's presented more uniformly, more common. C is the patients are giving wrong information. That's why the treatment will be incorrect. So first one is common, second one is less common, third one is wrong information. First one is more common, fairly common means more common. Second one is less common. Third one is wrong information. Yeah. Wrong information. More common, less common, and wrong information. Muthu Lakshmi can join. Tintu Jofin can join. And some people are coming regularly without registering. They're just attending freely. And those students who are paying the fees. Okay. Yes, this is for the students who are registering with us. One day, 2 days, I can give free sessions, but not always, right? Yeah. So, HS is a common condition. See, now I'm going to give you the arrows. Okay. Arrows. HS is a condition which is common. HS is a condition which is less common, because it is more if it is presented more uniform, that means it is less common. If it is present, if you come to my home, that means you did not come to my home, no? If you come to me, I will teach you. That means you did not come to me. How can I teach you? If you work hard, you will pass. That means you are not working. See why I tell this sentence. If you work hard, you will pass. If you work hard, you will pass. That means you are not working hard. That's why I'm telling you this sentence. If you work hard, if you work hard. Otherwise, I'll say you are working hard, you will pass. You are working hard, you will pass. If you work hard, you will pass. I will not tell that, because you are already working hard. So I can say you will pass. I'm telling you, if you work hard, you will pass. That means I feel that you are not working hard. That's why you not pass. Try to understand the sentence there. Okay, less common. And here, third one, HS is a condition which is misinterpreted, wrongly interpreted by the patients. If you understand, there is the fun of this one, you can notice here. The fun of this one, you can notice here. I'm giving you the red mark. Don't get confused with these things now. So, if you understand, then you can diagnose. If you can diagnose, then you can treat. You are treating because you are understanding. Understanding, diagnosing, and treating, or you can see there. They are one and the same. They are one and the same. If you understand, you can diagnose. If you diagnose, you can treat. What, Mr. Peter, you're talking nonsense. Yes. What I talk will be coconuts for you, because you cannot break the shell open. It is coconut. It's a hard nut to crack, because you don't see the logic between this. If you understand, you can diagnose. If you get diagnosed, then you can treat. That's it. They are one and the same. First one is better diagnosed. Second one is not diagnosed properly. Third one is not treated properly. One and the same. If you understand, you can diagnose. If you can diagnose, you can treat. There are many doctors. Now let us ask the doctors what I am talking is sense or nonsense. One doctor. Yes. Dr. Wasiur Rahman. Unmute, please. Dr. Wasiur Rahman. Yes, please unmute. I think Dr. Wasi is either busy or on duty. Okay, fine. Kalai. Kalai Chelvi. Guruparan.
Yes.
Yes. Am I talking sense or am I talking nonsense?
It's very sensible.
Okay, now you understand, right?
Yes, sir.
So, can you tell in your own words what you feel from this question?
First we have to find out the key points. That is the first learning from the question and the answers. Then we have to correlate those things. Then with the listening, we have to carefully listen what is the core point they are mentioning.
To some extent, 60% you are right. And there is some more secret here. There is some more secret. There are some more secrets here.
there is one thing is there A and B are opposite to each other, so we can omit the negative one by listening.
Okay. I think it will be very tough job for you because you are a beginner in this part. Okay, no problem. I will help you out. After telling this point, can you reach that point? You can tell afterwards. The first one is the ability of the doctors. Second one is the incapacity of the doctors. The third one is dependence on the patients. First one is doctor is very powerful. Second one, doctor is very weak. Third one is doctor cannot do anything without the help of the patients. Do you get the idea there?
Yes, sir.
First one is doctor can do. Second one is doctor cannot do. Third one is doctor can do with the help of the patients. So that's it. So first one is, the first point is doctors can diagnose. Yes, diagnose. The doctors can, yes, diagnose. Yes, it's a positive one. Yes, the doctors can diagnose. That is A, because it is very common point. Second one, doctors cannot diagnose because it is not common. The doctors cannot diagnose because it is not common. Third one is, whether it is common or not, that is not the problem, but it is the patients that are needed. So they have to understand. The patients themselves have to give proper information. Then only can the doctor diagnose. So the doctor is depending on the patients. That's it. First one is the doctor is very strong. Second one, the doctor is helpless. Third one is doctor can take the support of the patients. That's it. So these points you have to see. Now the words which are suitable is common, regular, normal, usual, universal, general. Okay. Present everywhere, regular. So these are the synonyms. You have to listen for these words. Condition prevailing everywhere. No common, no regular. Condition prevailing everywhere. Condition noticed, observed in the society, in all the societies. All the societies, all means common. Some of means uncommon. So try to understand the relating words here. So that is how you have to analyze this particular question. This is the way how you have to analyze this particular question. So simple as that. So if you can analyze these words, you can see. Right. So plan your question 90 seconds. Initially, it will take a little more time, but on the spot, you can do this one. This question, this test, first time I'm explaining to the students. Yes. Right. So this is the question. Finished. Next one. So question number 38. We are just studying the questions. Yeah. There you are. Question number 38. Go through the question. Write down the question, write down the options, and draw your own lines. Yes. So, Dr. Cooper explains that is a conjunction. One cause. So cause is what? What is one cause? One cause. What is one cause of this result? HS is the result. Maybe blocked hair follicles. Resulting from what? Resulting means effect. Result means effect. Consequence. Blocked hair follicles. Blocked hair follicles resulting from. So this blocked hair follicles is a result resulting from a cause. That cause. Blocked hair follicles is a cause for HS, and this blocked hair follicles is a result from what? Cause. There are two cause and effect here. Okay. Because of something, blocked hair follicles are there. Because of these blocked hair follicles, HS is resulting. There's a chain reaction here. There are two reactions here. First one is HS is because of blocked hair follicles. Blocked hair follicles are because of. Cause means because. HS is because of blocked hair follicles. Blocked hair follicles is because of something. Resulting means effect. What is the cause of this effect? Why blocked hair follicles? Why is this blocking of hair follicles happening? Shaving the affected area. So shaving. Shaving the affected area means shaving. So you shave with a razor or blade or whatever. Shaving the affected area. Okay. Because you shave, their HS, blocked hair follicles form. Because of blocked hair follicles, HS. So shaving is resulting in blocked hair follicles, and blocked hair follicles is resulting in HS. Blocked hair follicles is the cause of HS, but shaving is the cause of blocked hair follicles. Because of this is happening. Because of this is happening. If you do not work hard, you will fail. If you fail, you cannot enter the next level. If you do not work hard, you will not pass OET. If you do not pass OET, you will not get the result. You are not getting the result because, okay, you are not get one cause of failure. One cause of failure is because of lacking hard work, resulting from carelessness, irresponsibility. Because I am irresponsible, I'm not preparing well. Because I'm not preparing well, I'm not passing. Because I'm not passing, I cannot get OET grade. Because I don't get OET grade, I cannot go to UK. Chain reaction. Two reactions are there here. Don't get confused here. First one is because of shaving. Because shaving, blocked hair follicles. Because of blocked hair follicles, HS. The next one, overuse of deodorants. In this, which is the most important word? Deodorants. You're using deodorants, and that is overuse. So because of that, hair follicles, and hair follicles because of that, HS. The next one, smoking. Smoking is leading to blocked hair follicles. Blocked hair follicles resulting in HS. Or deodorants are causing blocked hair follicles. Blocked hair follicles are so shaving causes blocked hair follicles. Blocked hair follicles. So the other one is common. The other one is common. Why blocked hair follicles? What is the reason for blocked hair follicles? What is the cause for blocked hair follicles? Is it shaving or is it deodorants or is it smoking? Shaving, deodorants, smoking. So one of these three things are causing blocked hair follicles. Not HS. HS is caused by blocked hair follicles. But blocked hair follicles is caused by what? Resulting from what? Caused by what? What is the reason for blocked hair follicles? The reason is shaving. He is not asking the reason for HS. The reason for HS is blocked hair follicles. Maybe blocked hair follicles. But blocked hair follicles because of what? I hope you understood the point there. Now let me give arrows for you. Yeah. Blocked hair follicles cause HS. That's okay. There's no question itself because both are there in the question only. So this, we are not related to that. We are bothered about blocked hair follicles. What is causing? Shaving causing blocked hair follicles or deodorants causing blocked hair follicles or smoking is causing blocked hair follicles. Why is this blockage in hair follicles? Why is this block? This blocking is because of shaving or deodorants or smoking. There is the shaving causes blocked hair follicles. Blocked hair follicles cause HS. So blocked hair follicles causing HS, maybe that is not our question. What is causing blocked hair follicles is our question. The answer is there itself. Maybe or may not also. That's not our problem. What is the problem? What is causing blocked hair follicles? If you can come to the root of the point, then you can understand. The reason is either shaving or deodorants or smoking. That's so simple. You have to identify what is the noun there. Noun. Shaving is the noun here, gerund. Gerund, which is used as a noun. Deodorants, noun. Smoking is also gerund, is a noun. Gerund is one form of a noun. Name of an action. Shaving is the name of an action. I went for a shave. Shaving. Okay. I like apples. I like shaving. I don't like shaving. Doing something. Action. Name of a particular action. So you should know that nouns are very, very important. Nouns are very, very important. Remember that. So, if you have understood the question, say yes. The concept is clear, say yes. Type yes if the concept is clear. If the concept is not clear, say just no. Yeah. So we are moving to the next one. This analysis is very important. Many people don't analyze. They just wait for the audio. Okay. Analysis. Right. Thank you for responding. Your yes or no will help me that to understand that we are going in the right direction. That means we are together. Yeah. Yes. Here is the third question. This is the reason why part C is very difficult. But because you don't reason, nah, you don't understand the relationship, nah, you don't identify the important word. Nah. Now here I'll teach you some more techniques. Yes. When describing the case of a patient called Sophie, when describing the case of a patient called Sophie, so Sophie comes into picture here. When you hear the word Sophie, I have a patient by the name Sophie. Then you have to change. Dr. Cooper suggests that. Dr. Cooper suggests that. So after that, the question comes, answer comes. What does he suggest regarding Sophie? So regarding Sophie, what does the patient suggest? He is describing the case of a patient called Sophie. That time he suggests something about HS. He's talking about HS. He's talking about HS. He's talking about HS. So here there is something called commonality. Now something called commonality. So this is HS is common. HS is common. Which is common in all the three things can be eliminated. This is called elimination technique. So elimination technique, HS, HS, HS. I'm showing you another technique now. Okay. Right. So HS, he's talking about HS. He's talking about an attitude or attribute or component or point regarding HS. Right. He's talking about a tendency. Now he's talking about a point, a tendency, a concept, an attitude, a component, an ability, a possibility of HS. Okay, it's a possibility of HS. The next one, he's talking about the diagnosis of HS. So diagnosis of HS. HS has a tendency, attitude, nature of HS, possibility of HS. Second one is diagnosis of HS. Understanding what is HS, identifying HS, evaluation of HS, okay, assessment of HS. Then he's talking about a treatment of HS. He's talking about treatment of HS. What type, what approach, what mode, what manner, what technique you can use for the treatment of HS. A treatment approach, 1, 2, 3, 4, 5 different types of treatments together you have to do. So it's a treatment, not single treatment, multiple treatment approach. One is not sufficient. Multiple ways you have to attack it. First one is the nature of HS. Second one is diagnosis of HS. Third one is treatment of HS. Is he focusing on attitude? Is he describing what it is, or how to diagnose it, or how to treat it? First one is the characteristic feature of HS. Second one is how to diagnose HS. Third one is treatment for HS. All others are unimportant. All the others are unimportant. Now you see, you watch a movie, especially an Indian movie. Okay. In these movies, you see some dances. Some dances. In those dances, a stage is set, a number of people are dancing. There may be 20 to 30 dancers on the stage. But will you see each and every dancer? If you are watching, studying each and every dancer, that means you don't have focus. Your focus, your concentration, your attention will be on one particular dancer. That's it. You can only focus on one and his movements and his steps. All others are just, they are there. That's all. You will not even notice them. You will not even bother about them. Why? Because that person is very important. And that person is called the hero of the sentence. And all others are zeros. Because they do not drag our attention. So why are you bothered about all the other dancers? Focus on the main dancer, the hero or the heroine. That's it. So now, is it talking about a characteristic feature of HS? So feature or attribute or quality of HS? Or is it talking about how to diagnose it? First one is what is HS? Second one is diagnosis of HS. Third one is treatment for HS. That's it. These are the three things. Tendency of HS, it tends to progressively worse. It has a tendency to get progressively worse. It becomes worse gradually. Gradually, increasingly, it becomes worse. Now it is 1 point, 2 points, 3 points, like that. Increasingly it worsens. It is its tendency. It goes on increasingly bad. Second one is how to diagnose it. All others are not important. May require a full patient history or may not require full. That is not our problem. Diagnosis. So how to diagnose this? Second one is how to treat it. So now, how is HS? How to diagnose HS? How to treat HS? So HS is what? So second one is diagnose requires what? Treatment needs what? So they are the focal points. Try to identify those points. There are many students, regular students. They pay hundreds, thousands, but they don't want to attend. Okay. What to do? Yeah. So is the information clear? Is the concept clear? Elimination technique. HS, its tendency. HS, its diagnosis. HS, its treatment. Tendency, diagnosis, treatment. HS, we already know the entire topic is HS. So why it is important? Remove it and throw it out. So, question 39. Clear enough? If it is clear enough, just give yes. If it is not clear, just say no. Please, so that we can move to the next question. I'm not giving you the answers. I'm giving you how to identify. This is called pre-listening phase. Pre-listening phase. Pre-listening phase, while listening phase, post-listening phase. Okay. Pre-listening phase, while listening phase, post-listening phase. Before the audio starts is pre-listening. Okay. After the audio starts is post-listening. And when the audio is playing, that is while listening. Just hit a yes. Yeah. So 4 people have given a yes. Thank you. Hmm? Yes. After explaining so much, I'm asking you to give one word, whether you understood or not. You're not interested to give the answer yes or no. So great. Hmm? For whom I am asking? If you say I understood, I'll be happy, na? So that I can. If you don't understand, then why? You don't know whether you understood or not. At least, hmm? Please respond when asked question. One particular thing I ask. I don't ask too many things. Okay, that's not fair, right? Somebody is struggling for you, and don't even. Hey, doesn't he deserve to know your yes or no? Anyways, no problem. 37, 38, 39, 40. Yeah. So just analyze the question on your own before I start explaining. So analyze the question before I start. The reading techniques I'm explaining. Okay. Analyze those questions. This session I'm explaining for the first time. Dr. Shabnam. You're late. No problem. You can visit afterwards. You can ask me later. And all the newcomers, you can attend for 1 day or 2 days only. Simon Sir's techniques are not freebies. They come with pain and strain. So I cannot deliver all these things every day freely for you. So already I have locked the room. Only those students who are coming for the first time and second time, they will be permitted. If you really want to attend regularly, then you have to register. Dr. Molaleki. So I want you all to identify those particular words. There are only two words, one word from the stem and one word each from the options. It's so simple. Simple. Can you identify? Now I'll give you a chance here to learn. Question number 40. The most important word in the stem. Come on, write down one word. All of you. One word. Dr. Cooper says that a treating patients with HS should be aware that the condition. I want you to identify. How many of you can identify? Let me see. The most important word. I already gave a clue in the previous sentences. Still you did not catch the clue means I feel very sad of it. I'll tell you. I'll tell you what is the clue. Yes, Rakhil Barkat. Welcome. Good evening. I remember you by your full name. You're a very obedient student. I know that. One word. Not even a single candidate has given the right word. Come on, second chance. Dare you. I'm giving a second chance. First chance, everyone failed. Let me check second chance. Yeah. 3 students have given the right option. Now let me tell you one thing. Whenever you go through any particular question, whenever you go through a particular question, there are two things. Now, there is a sentence. Okay. Now, here, I'll give you one sentence. A sentence has two clauses. A sentence has two clauses. I told you that you should attend regularly. Full stop. I told you that you should attend regularly. Now in this, there are two clauses. There are two clauses. And these two clauses are separated by that. Okay. I told you that you should attend regularly. Which is important in this? I told you is important, or you should attend regularly is important? Which is important? I told you is important, or you should attend regularly is important? Which is important? I told you is important, or you should attend regularly. One is important, two is important. Which is important here? I told you is one. You should attend regularly is two. So I think you can understand what I am talking now. I told you is one. You should attend regularly is two. I told you is one. You should attend regularly is two. So now you have to see that. So can't you focus on that one, which is, I told you is not important. That is background information. I told you is not important. That is background information. Before that is called background information. Before that is background. This is not important. This is background information. After that, this is important. This is important. This is important. Okay. Now in this, you should attend regularly. You should attend regularly. In these four words, which is important? 1, 2, 3, 4. First word, second word, third, fourth word. Which is important? Only one word. You should attend or regularly. Which is important? Come on. If you say regularly, what regularly? What regularly? Attend regularly. So attend is very, very important. This is very important. Attendance is important. Regularly is talking about attendance. Attend is very important. So focus on the word attend. In the same way, I think you understood now what I am talking. So that is here. How many times I should tell you? How many times I should tell you? That is very important. Before that is background story. This is not important. This is not important because question is on not that one. What should we be aware of? Aware of what? What should you be aware of? Yeah. Now let us see. The word condition is very important. The word condition is very, very important. Condition. The word condition is very important. You could not identify that in the first step. Now let us see this one. Now in this, okay, in this one. Now I'm taking this one. In this sentence, which is the most important word in A? Which is the most important word in the branch A? Identify. Think very carefully. Don't just jump into a conclusion and give your answer whatever your mind blows. One word which is very important, extremely important. Mind you. You are coming my way. You are bright students now. You are coming my way. Now you will not miss a beat. Okay? You will not do mistakes. Come on, write down. Others are writing. Why should I write? Others are eating. Why should I eat? Others are sleeping. Why should I sleep? Others are getting results. Why should I get results? Come on, do your job, no? Can't you type one word? It's a shame on me if you don't write. I cannot make my students write what I want. Then why am I here? Why are you here? 5 letters you cannot type? And what for you are staying on the platform? Is this called learning? Next. Now let us take option B. I'm making you to go fast now. Option B. Come on. Think very carefully before you submit the answer. One particular word. Come on. Think very carefully and write. One answer is given. Yeah, trigger is the word. The condition triggered. Okay. What a triggered we don't want. Anything may trigger. One trigger. Episode of depression is one trigger. Maybe by another one also. Who knows? Triggering factor. The condition is triggered by what? What is episode of depression or whatever it is, that is we don't need. The triggering factor. Okay. The condition is triggered by something. So the triggers. What triggered the condition? Okay. What triggered the condition? Yes. Next one. See. See. Think very carefully. If you say difficulty, difficulty for what? Difficulty for what? Treatment. So treatment is the problem. Okay. Conditions treatment is difficult. Difficult what? Treatment is difficult. Conditions treatment. Conditions triggers. Conditions recurrence. Don't you identify this one? The recurrence of the condition, the triggering factor of the condition, and the treatment of the condition. He's talking about the treatment, that it is difficult. Difficult. What is difficult? Treatment is difficult. So treatment is the problem. The condition is recurring. That is the problem. Condition is triggered by something. That is the problem. Condition's treatment is a problem because it is difficult. So these are the words which you have to follow. Right. Conditions, recurrence, conditions, trigger factors, conditions, treatment. So recurring is the problem. Okay, because even after many years, after disappearance, after many years, it may come back. So something may cause the condition. Something may trigger the condition. Okay. Condition may trigger or condition may be treated. Treatment is difficult over time. So this is how you have to analyze. Nouns are very important. May recur means recurrence. May be triggered means triggering factor. May be difficult to treat. Treatment is the problem. Okay. So this is how you have to analyze the question. So question number 40. Concept clear. If it is clear, you say yes. He's talking about recurrence, reappearing of the condition. He's talking about the triggering factor of the condition because it may be caused by an episode of depression. That is different thing. Maybe or may not be. Maybe something else. But triggering factors he's talking about. Then treatment he's talking may be difficult to treat over time. The more the delay, the difficulty it is, the more difficult it is. Yes, 6 students out of 17 have given yes or no. Thank you. At least 6 people are there. Yeah, next. One word that is called the pulse. Okay. If you want to give the injection, you will find the location. How can you give your answer when you can't find the vein where you have to give the injection? How can you insert the cannula? Find the location properly. Huh? So 9 students. Thank you very much. At least half the students. Thank you once again because okay, your encouragement is more important. Otherwise, how can I explain you more? At this hour of the night, nobody will be interested to teach, first of all. Somebody is teaching. Okay? Be happy to respond because your response will make me teach more. Yeah. This is the fifth question. Yes. Now in the STEM, okay, question number participation 41. STEM. STEM. In the STEM. So I am pointing out the STEM here. So this is the STEM. In the STEM, okay, in the STEM, how can we separate the important and the background? The question part and the background. Okay. Why I am, yeah, sorry, 41 and STEM. Don't send any personal messages to me, please. Because if you're sending personal messages, it is going to you only personal messages. So let it be group messages. Don't send personally to me, anybody. Yeah. Yes, please. The separator is that every question, you should remember the separator that. Okay. So this is the background, which is not important. Okay. The patient's name is Emily. This is the pointer. This is the orientation. So Emily comes this question. Okay. So you can switch on to this particular question. That's the point. Now, in the STEM, what is the most important word in STEM? Important word. Mother is important, or attitude important, or her is important, or Emily is important. Her means Emily. Mother, Emily's mother. Attitude, which is the most important word. So he's talking about the attitude. Very good. So before that is not important. You can forget about that. Okay. There's a background story. That's all. So attitude is the most important word here. Right. Now coming to the point. Now set A. Okay. Set A. So which is the most important word in set A? A. Okay. You can use two words, but any word is the same meaning. Okay. There are two words which are very important. Okay. Any word you can take. Lack is a lack is an attitude. Okay. So attitude, lack is an important word here. Is it so? So there are two words which are very important, either sympathy or understanding. If you understand the situation, you show sympathy. If you have sympathy, you show understanding. Sympathy and understanding are one and the same. If you understand the other person, you show, say a poor person is there. You understand that he's poor, so you will show sympathy. A patient is suffering, you can understand that, so you will show sympathy. If you don't understand his difficulty, how will you show sympathy? Sympathy and understanding are one and the same. Okay. So you can take sympathy or you can take understanding. Attitude is understanding or attitude is sympathy. Sympathetic attitude or understanding attitude. That is lacking or not lacking, that is different thing. So he's talking about the attitude, sympathetic or understanding. Okay. Not sympathetic, not understanding. That's okay. Sympathy is talking about the sympathy of the mother. Mother's attitude, okay, is talking related to sympathy, that no sympathy. Sympathy is more important. Lack, no is not important. Sympathy, yes sympathy or no sympathy. So sympathy is more important here. If you have sympathy, you have understanding. If you have understanding, you have sympathy. So anyone, both are one and the same here. You should understand. Right. So main, the word we can take it as sympathy. If you are having sympathy, that means understanding is there. So that's it. So take one word, sympathetic. That's enough. Next. Next, let us take the word part B. What is the most important word here? Come on, give your answer, please. Good, good, good. Come on, come on. So confirming what? Diagnosis. Delay what? Confirming what? Diagnosis. So what is the most important word is diagnosis. Whether it is correct or not, that is secondary. So diagnosis is the important word. It's talking about her attitude towards diagnosis. No, attitude towards delay, no. Attitude towards diagnosis. Okay. Diagnosis is important here. Delay what? Delay in confirming. Confirming what? the diagnosis. So diagnosis is important. Okay, diagnosis is important. Now let us go to C. C. Yeah, now you people are coming my way. Muthulakshmi, severity what? Severity of what? Severity? Severity, what severity? Symptom is more important. Good, good, and good. Attitude, symptoms is the key word here. So, her mother's attitude has resulted in sympathy, resulted in, led, see, reflected, led, and contributed, all are same. Reflected means resulted in, led means resulted in, contributed means resulted in. Same. Okay. Led to, contributed to, resulted in, reflected in. Same. Result, led, contributed, reflected. All are same. So first one is talking about sympathy. Okay. Attitude reflected in towards sympathy. Attitude reflected in diagnosis. Attitude contributed to or reflected to symptoms. That's it. At the end of the day, attitude reflected means led to, means resulted in, means contributed to. All are same. So this is synonymous language. Synonymous language. Synonymous language. This is same. So they are not important anymore. Reflected in, resulted in, led to, contributed to. Okay. So all the same things. Lack of means no. Delay, severity of. Okay. Delay in, lack of, severity of. They are not that important. Confirming something. Correct what? Severity of what? Symptoms, diagnosis, sympathy. So you should know how to analyze the question like this. It's okay for spending time, for quality time. Yeah. People don't have time, no? They are tired. Huh? They don't want to attend all these things because these are hard nuts to crack. Yeah. Here comma is the separator and when is the connector. Instead of that, we have when here. This is the last question. If you do some for 1 week at least like this, C part will be just like a banana. Just I'm peeling it off. You can just swallow it. So practice like this. Before you start listening to the audio, take the paper and analyze like this. Study, study, study. Afterwards, doing will be very easy. Yeah, there's a pass. Okay, so for the students who are new, mostly they are regular students only. But for the new students, welcome you all for this platform. This is a wonderful platform to learn. Let me introduce myself to you. My name is Peter Simon, and I am a certified OET trainer. So the qualifications required for a trainer are professional academic qualification, that is English certification, Bachelor of Arts or Master of Arts, and I am Master of Arts. I have a certificate, Master of Arts. Number 2, professional qualifications. That means teaching qualification. We need Bachelor of Education or Master of Education. I have a certificate. I hold a certificate, Masters in Education. And I'm a teacher trainer. I'm not just a teacher, I'm a teacher trainer. Many people you might be seeing, they will say, if you ask them, we want reading and listening, then you will know whether they are real teachers or artificial teachers or so-called teachers. You will know that. If they say, nobody can teach you reading and listening, that means they are cheating you. If they are if they are real teachers, they must teach you reading and listening. Otherwise, they're just making some money out of your ignorance. If somebody says, we cannot teach you reading and listening, but we'll teach you writing and speaking, that means they just want to make money out of your ignorance. So don't go to such people, because they just take your money and they say, you do all the hard work, we'll just do some corrections. Easy cake. So they don't have professional qualification and both academic qualification. And the third qualification is experience. I am 53 and I have 34 years of teaching experience. So experience is very important. And lastly, the fourth one is I have a certificate, CELTA, from Cambridge University, certificate of English language teaching to adults. C, certificate of teaching, T, sorry, English, certificate of English, E, language, L, teaching, T, A for adults, certificate of English language teaching to adults. So that is my certificate. So don't listen to somebody if they say nobody can teach you reading and listening. So try to understand that they are not capable to teach reading and listening. Okay. And next, so to the students who are new, Ashmita is a regular student. Dr. Shabnam is a regular student. Dr. Wasi is a regular student. Hifza Jailan is a regular student from Pakistan. Khalai is a regular doctor student from Dr. Khalai. Khalai, okay, I don't remember the full name. Sometimes I remember, sometimes I forget. And she is from Sri Lanka. And then Kareem Sahib is a guest today. Muthu Lakshmi is a regular student. Okay, Omar is a guest. Pooja Kesar is a regular student from Nepal. Priya is a regular student, registered regular student. Raji Lakshmi is a regular student. Rakhil Barkat is a regular student. Sajida Tabassum is a regular student. Vinita is a regular student. They have registered with us. And Misbah Kumar is a guest today. So those who are guests, those who are attending these sessions, if you want to attend the regular sessions, you can register with us and you can have the regular sessions on a daily basis. I'll give you permission. I'll give you permission to come for 1 or 2 sessions. Afterwards, the doors will be locked for the guests. This is a demo session, so I gave you. If you're interested, you can contact me. And the number is +91 9877867360. This is my number. So you can copy and paste and you can contact me for subscription. And only serious students can contact me. Otherwise, please don't. If you're interested to attend regularly and clear it, then only you can come. Okay? So, right. Now, for your information, I want somebody to discuss about our sessions, because if I tell about these sessions, maybe it will be like beating my own drums. I don't like. So I want somebody to speak about these sessions. Maybe the youngest one, Ashmita. Ashmita. Hello, Ashmita. Can you unmute for me, please? You can share your experience of these classes. Or Dr. Shabnam. Feel free to share your experience.
Hello, sir.
Yeah, Ashmita, can you share your experience regarding this?
This nice session, sir. You teach very well. After joining your class, I know how to how to read, how to reading, writing also, and how to read the sentence as well. And it's a very effective class for me. And thank you, sir, for this class.
Yeah. Oh, that's it. So she is Ashmita from the UK. She is preparing with us. She registered recently and she is attending regularly. Okay. So, right. Rajya Lakshmi. I will share, sir. Okay, Rajya Lakshmi. Yes, please. You can unmute.
Good evening, sir. Good evening,
Yes.
everyone. Really, I would like to tell you today's section was very nice and real understandable. And no one can teach like this, according to my opinion. It's and reading and listening. I have here many of the institutes, like my colleagues. Uh, no one can teach like sir. He'll take the specially for the reading and listening classes. It is very useful for us. I miss the classes. I delay my exam, and now I am practicing seriously, and I want today class is really effective for everyone. And really I'm very thankful to you, sir. And everyone please attend, and you tell to your colleagues also to join for the classes. It is. Thank you, everyone.
Thank you very much. So, here back. Now here, the last point. Let us see. Now we go to the last point. So this is the stem. So the comma. When is the connector here? And comma is the separator. So this is the background. So nothing is important here. So the important is Dr. Cooper recommends they should. Dr. Cooper recommends that. Here is that invisible. Dr. Cooper recommends to us, to everyone, that they should. Everyone should. They means everyone should. They should. Nothing is there in this one. Nothing is there. They should. People should. People should do what? Do what is important. So question, there is nothing. In the stem, there is nothing important. Everyone should what? Should do what? Everything is there in the option B. So he is giving one suggestion. He is giving one suggestion. So what is that suggestion? He is recommending. His recommendations. What is the recommendation? Should do what? Dr. Cooper's recommendations. Recommend what? Cooper is recommending what? He's suggesting what? He's advising what? He's prescribing what? He's telling about what? He's advocating what? Advocating. All these are the words which you may hear. Which you may hear. Yeah. So be careful. So now, done with that one. There is nothing important in that. So the only one word that you can take is recommends. What is the recommendation? What is his recommendation is to do what? What is the recommendation? Right. Now let us see here. In A, what is it? What is it? In A, what is the most important word? Most important word. One word, Kalai. One word. One word. Nobody. No one. Try a second chance. Nobody gave the answer. Nobody gave the answer. Yes. Food is the right answer. Food is the right answer. Healthy what? Eat what? Brown bread is what? So food. It's food. He's recommending regarding food. Brown bread is an example. Healthy what? Food. Eat what? Food. Brown bread is what? Food. So everything is going to food only. Can't you identify this, my dear? Huh? Why are you hurrying? Culminating, finally going to where? Eat what? Food. Healthy what? Food. Such as brown food. What is this brown bread food? Such as means an example. That is not important. That is only such as brown. Brown bread is not important. What is brown bread? Brown bread is a food item. Okay. Now let us go to B. In B, in B, one word, recommending regarding what? According to B, one word which culminates, final. One word, Puja Kesri. One word. I don't want two words. One word. Yes, dairy is the right answer. Muthu, I wanted to tell your name, but you already changed your answer again to another one. I am noticing everything. Dairy. Yeah, dairy. Products. What type of products? Dairy products. Dairy. Dairy. Such as milk, curd, butter, or whatever it is. Actually, Muthulakshmi gave one answer. Then again she shifted. I don't know what made her do it. What triggered her to give the second option, I don't know. That means she is confusion. She's not confident. Okay. So Pooja gave the answer. That is dairy. That's it. So dairy. Products. What products? Dairy. Products can be any product, na? But dairy is the key word. Yeah. Intake. What? Dairy. Items. Restrict what? Dairy. Everything is ending in dairy. That is what you have to identify the most important word. I'm helping you, na? People don't want to attend the session. Peter sir is crazy. He doesn't have any work. Peter sir thinks that we don't have any work. Of course. Now in C. C. Yeah, you are very powerful now. Very powerful. Good. Good. I really appreciate. I commend. I don't recommend. I commend you. Commend. What do you mean by commend? Means appreciate. Your performance is commendable. Okay. Alcoholic. Alcohol. So foods. Healthy foods are encouraged. Healthy foods. He's talking about foods there. Okay. He's recommending about foods there. Food items. Eat good food. Eat healthy food. That means do not eat unhealthy food. That's the thing. He's talking about food. Whether eat healthy food means do not eat unhealthy food. So healthy or unhealthy is not important here. Food is important. Food should be healthy. Okay. Food is important here. He's talking only about food. And food should be healthy. That's the next point. And that healthy food you should eat. So he's focusing on not on eating, but he's focusing on foods. Second one is restrict, means control. Control what? So A is also right. If restrict is right, A is also right. Eat healthy foods means restrict unhealthy foods. Same thing, na? Eat healthy foods means avoid unhealthy foods. Avoid means restrict. Avoid. The same thing is here also. The same thing is here also. Eat healthy foods means avoid unhealthy foods. There, A is also there, B is also there, C is also there. So everything is right there according to that. If you take restrict is important or healthy is important or avoid is important. No, they are not important. Okay. So what is he talking about? Is he talking positively regarding healthy foods or dairy products? Is he talking about dairy products and asking him to control, restrict? Or is he asking to about drinks, alcohol and avoid all types? So you have to focus on that area. Is he focusing main on foods or dairy or alcohol? What exactly is talking about? What is the recommendations regarding food or dairy or alcohol? In that manner, you have to see the other areas also. Yeah. Recommending foods. Oh. Yeah. Is he recommending food or is he recommending dairy or restricting dairy? Is he talking about alcohol? What is his main focus? Okay. Eat healthy foods. So this is positive. Restrict their intake. This is negative. Okay. Negative. And avoid is negative. Okay. That's it. So you have to see these positive or negative traits also. Yeah. So this is the way how you have to analyze. Okay. So this is the reason why it is very difficult, because you don't analyze the points. You don't analyze the points. Yeah. Yes. Get ready for this now. Yes. So we are going to play the audio continuously. Get ready with everything. Hide. Yeah.
Occupational English test. Now look at Extract 2. Extract 2. Questions.
They reported that as a result, their pain diminished.
So the treatment was useful.
Mm-hmm.
Does it have any other advantages?
Well, we followed up patients after different periods of time, and the improvements were still there, but not to the same degree. but the decrease in pain levels was still statistically significant. But this kind of treatment is very easy for patients to do at home once they've left the hospital. They only need a computer with a webcam and the program.
And this research is ongoing, of course, so we can...
Yeah. Now the question to you is, are you ready for the... So you are ready, you have sharpened your knives and you are ready for attack. We are on war. Are you ready for the show? Yes. You already sharpened your axe. Now you can go to the trees to cut down. That's it. You're ready. Yeah. Now don't write anything in the chat box. Stop. No more writing. Write in your notebook questions 37, 38, 39, 40, 41, 42. And in that notebook you have to write. Afterwards you have to send that photo to me. Yeah. Silence. We are on fire.
Now look at Extract 2. Extract 2, questions 37 to 42. You hear a dermatologist called Dr. Jake Cooper talking about a skin condition called hidradenitis suppurativa, HS. You now have 90 seconds to read questions 37 to 42.
Hello, my name's Jake Cooper. I'm a dermatologist, and I'm going to talk about a skin condition called hidradenitis suppurativa, commonly abbreviated to HS. Let me tell you a bit about this condition. HS is a chronic inflammatory disorder characterized by painful swollen lumps on the skin, which may break open, releasing fluid or pus. It's also called acne inversa, and in fact, sufferers often think they've got acne or pimples. But unlike acne, HS affects apocrine gland-bearing sites, in particular the armpits and the pubic regions. It's not a very well-known disease in the medical community, which is surprising, as it affects about 1% of the population, and early occurrences are commonly misdiagnosed as simple nodules or abscesses. This is unfortunate, as the condition can be very distressing for the patient. We don't know exactly what causes HS, though it seems to be linked to blocking of the hair follicles in the affected area. It tends to occur most often in younger females, and it's often found in patients who are overweight. Studies carried out into a possible link between deodorant use and HS have so far been inconclusive, but the condition is more prevalent amongst smokers, and there's some evidence that nicotine may affect the follicles. Patients sometimes worry that they've caused the condition by shaving, or possibly by using depilatory creams, but there's no evidence that either is a contributing factor. Let me tell you about one case I encountered recently. This was a 22-year-old woman called Sophie, who came to see me because she had a number of painful boils in her groin. These had been occurring with fluctuating severity for the previous 3 years. When I questioned her further, I learnt that she'd previously undergone incision and drainage of various lesions on multiple occasions at various medical centres. She also told me that she'd taken a course of an unknown oral antibiotic to treat an abscess about 2 months earlier. So I was able to put 2 and 2 together and make a connection with HS. Then we could start to think about the right sort of long-term treatment for her. When treating patients with HS, it's important to be aware of the impact it can have on them. Many studies have confirmed that patients with HS commonly experience depression as a result of their condition. Additionally, HS has a significant psychosocial impact. Patients reported feeling unworthy and unlovable, and described their lesions as ugly, smelly, and embarrassing. In some cases, symptoms may spontaneously resolve themselves for long periods of time, but both doctor and patient need to remember that there could be a flare-up years or even decades later, and that currently, treatment is limited to finding a way to manage the condition. HS may present itself in younger patients too. In another case, I saw a 14-year-old girl called Emily, who came to see me with her mother following a diagnosis of HS by her GP. We needed to confirm the diagnosis and decide on the most appropriate treatment. Her mother expressed concerns about what she referred to as Emily's unappealing hygiene. This was said in front of the girl. Now, we know that HS is notably not due to poor hygiene. While HS is a skin disease, it's happening lower in the dermis than just the surface level. In this case, Emily had a lesion on the mons pubis, which required surgical intervention. Following incision and drainage, her condition improved, but this does illustrate the need to consider not just the patient, but also the attitude of family members. In general, when it comes to treatment, once we make a diagnosis, there are multiple therapies indicated, depending on the severity of the disease and patient presentation. One thing patients often ask me is whether they need to make changes to their diet. One small-scale study followed 12 HS sufferers who cut out beer from their diet, together with other foods containing yeast, such as bread and some types of cake. And this did appear to have an effect on their symptoms. It's also known that overproduction of one group of hormones called androgens may contribute to the symptoms of HS. These hormones are linked to insulin, and foods such as milk and cheese can raise insulin levels. So reducing these types of foods might be helpful. However, a controlled diet, which leads to weight loss, is certainly recommended for patients who are overweight or obese.
That is the end of Part C. You now have 2 minutes to check your answers.
Right. So get ready. We're opening the answers. Yes. We are declaring the answers now. So, Rajya Lakshmi, write number 37. And when I count down, all of you write the answer, please. This is question number 37. Yes.
That is the end of the listening test.
Yes. Rajya Lakshmi, type number 37. Yes. All of you can submit your answer. 7, 6, 5, 4, 3, 2, 1, and submit. Yes, submit your answer. All of you. Now I'm going to declare the answer for you. The answer is 31. 37, sorry. Yes, 37. So 37, yes. 37 is A. If your answer is right, write 1 by 1. If the answer is wrong, write 0 by 1. Yes. Yes, all of you have done. Next one, please respond. Please, please, please actively participate. This will give you boost up. Okay. Then question number 38. Yeah. 38. 38 is this. Yes. 7, 6, 5, 4, 3, 2, 1, and submit. We're creating that suspense and thrill. Okay. 38. Yes. Very good. Very good. Wonderful participation. Okay. 38 is here. 38 is a C. So submit your marks 2 by 2 or 1 by 2 or 0 by 2. Whatever is appropriate. Yeah. It's okay, Srija, no problem. Not only you, there are many who got 0 out of 2. I told you, no, it's little tough to, at least you got some ideas. That's okay. Yeah. Yes. Question number 39. It's 7, 6, 5, 4, 3, 2, 1, and submit. Participation is more important than winning the game. That is called sporting spirit. Don't kill your sporting spirit. Attack. If we are losing now, then tomorrow we can gain. right? So no need to worry about anything else. Yeah. Question number 39. Is B. So the answer is B. Submit your scores 1 by 3 or 2 by 3 or 3 by 3 or 0 by 3. It's okay. To get 0 by 3 also is okay. No worry at all. It's okay. Yeah, no problem. You're just learning. We have that sportsman spirit. That is called sportsmanship. Gradually, we'll definitely do it out. We together can do it. We together can do it. Question number 40. Seven, 6, 5, 4, 3, 2, 1. Submit. Ashmita, slow down, please. When I tell submit, then you can submit. Yeah. Answer 40 is A. Submit your scores, please. Ashmita got 1 mark. Sajita got 1 mark. Very good. Yeah, I told you, no, wait. We will. Yes. Hebza, 1 mark. Very good. It's enough. Today 1, tomorrow 2, like that. Srija got 1. Now be happy. We got it. We got it. Nobody's 0 now. Okay. Let's move forward. Yes. Question number 41. 7, 6, 5, 4, 3, 2, 1, and submit. Yes. Rija got the second mark. Yeah. Submit your scores, please. You're going in a very systematic manner. If you are really learning something, bring your friends. And we'll give them 2 days demo session. Question number, 42, right? Question number 42, yeah. Seven, 6, 5, 4, 3, 2, 1, and submit. Yeah. And the answer is Yeah, question number 42. The answer is B. The answer is B. So that's the key for your questions. That's the key for your questions. If you have check your papers once again. Right. This is for the students who are correcting online. Many students, hundreds of students. Yes. So they are doing online. So this is the key for you. You can go through this and you can correct your answers, please. And then yeah, that is Grandmaster class. Right. So please provide your valuable, and maybe I'll start a reading session. I don't know. If you are interested, you wait on, and we'll take a poll. How many of you are interested? I will ask a genuine question. Shall we continue today or shall we take tomorrow? Then we'll go close the session. Please wait. Don't hurry. Some people think, it's finished like that one. So after they go, many times I take the class, continue them. Please provide your valuable feedback regarding your session. Shabnam, very fast. Huh? Yeah, please provide your valuable feedback regarding your session or this session. Please. We welcome your comments and suggestions. Give your suggestions. Give your suggestions. Yeah. Reading session is only for the regular students. I'm sorry. The next session is a very serious session. So daily one session I'll give for the visitors. So those who are interested, you can contact me. Yes, Kalai. Kalai, are you comfortable? You can just share your experience, Dr. Kalai from Sri Lanka. Kalai Chelvi.
Just in the listening, the most difficult part is the part C. But today only I could understood the core point that where we have to give the heaviness, important point, important thing. Then we can easily mark the correct one, because I did several practice in part C always. My maximum score was 3. Today only I could able to get the 5. That is also usually I got 1 or 2. The maximum.
Somebody clap your hands. Somebody clap your hands. This is a doctor talking about her experience. She got 5 out of 6, it seems. Earlier she used to get 3. Just to give a clap or something. Yes, encourage. Somebody is speaking. Now they have courage, bold enough to come and speak. Yes, Dr. Kala, you paid 25,000 for 1 month. For doctors, I charge 25,000 for 1 month and 40,000 for 100 days. And for nurses, I take less fees because children, they get less salary compared to doctors. So I give them special fee for them. So you pay 25,000 for 1 month course, and with great difficulty you have joined the classes. You waited for 2 days or 3 days so that somebody, an Indian counterpart, a friend of yours, takes time and register. Then you said, I told you join, no problem. You said, sir, I'll wait and I'll register. Then I'll come proudly to attend your session. That's what you told. Do you think that this session is worth your 25,000 bucks?
More than more than it's worth, sir.
Yeah. Now there are many doctors who think, why should we pay so much money for any teacher? They think like that. What is your message for these doctors? Because many doctors, they face difficulty, but they think that they can do on their own, their hard work. Nobody can teach reading and listening. Now tell me, you have lost 2 times, and now you have come to me. And what's the difference that this Grandmaster class sessions made in your life?
Most of the almost all the doctors in Sri Lanka are doing self as practices. So they don't know they can identify the mistakes by their own assessment. So better that they have to follow an ideal class. This is the one of the ideal one, and also it is very helpful to getting the tips. The tips is the important because English is a language that is not assessing the knowledge. So we have to know the tips and we have to apply that. Suppose if we are studying a subject, we can study and pass, but this is not like that.
Okay. Thank you very much. And anybody wants to speak regarding the session, you're welcome. Just type your name here if anyone is interested. Yeah. If anyone is interested to share your experience, you're welcome. You can type your name or just type me. Then I will give you the mic. Right. Now coming to the point. Yeah, one from nurses I can ask. Pooja Kesari, do you want to speak? Your experience, Pooja Kesari from Nepal. Yes.
Hello, sir.
Yes, dear. You can share your experience.
Mm, yes, at the initial starting point, I am not interested to take your classes because I really feel bored after taking. But nowadays, I'm really interested, and I learn too many tips from your classes daily, and also your colleague also helped me regarding speaking, writing, listening, reading, everything. It's really amazing class. Grandmaster class is really best class.
And how many speaking sessions you are doing every day?
Every day, I do at least 5.
That's the spirit. There are 5 groups, so you can do 5 into 2 speaking sessions. And if they are available, you can take additional sessions also until you feel confident. There are some students who are not attending. So if you're really interested, you can take more sessions and you can gain that confidence, practice before coming to me for final reviews. Okay, now coming to the point. Now it is 12 o'clock, already past. So reading test. Now, what is your opinion regarding? Are you tired? I am not tired. I am not tired. But I'm asking you all because I don't want already two jumped out. Okay. So I'm asking you all. Shall we continue? That is A. A is continue. Or B is tomorrow. B is tomorrow. Which one do you say? B is tomorrow. Anyone, whatever. Yes. So let me see how many A's and how many B's. I'm ready for both. I don't have any problem. I'm ready for both. So, Vinita, count the number of A's, and Hifza, count the number of B's, please. A4 or B4? Vinita, I forgot what I told you, A or B? Okay, 3 B's. That means 4 A's. So that means remaining students did not say anything. So 6 A's. Wow. 6 A's. So okay, then we can go ahead. 7 A's. Right? We can go ahead. We can go ahead. But I need a small break. Can we take 10 minutes? Okay. Okay. 10 minutes. Sorry. 1 second. 10 or 20, or you can recharge your battery. No problem. That's up to you people. Okay. And take your somebody's phone or take the second phone. No problem. 10, 20, 30 minutes. Which one you prefer? 10 or 20 or 30? Come on. Majority I will take. Because if you are taking a session, I'm not going to eat anything now. I'm ready for anything. No problem. Yeah, okay, Srija. Fine. So how many 10s, how many 20s, how many 30s? My health is fine. No need to worry, Muthu. My health is very fine. Okay. Yeah. How many 10, how many 15, how many 20? Yeah, come on, come on, come on. Don't worry, I am fine. I'm very fine. Don't worry. God has blessed me with wonderful health. 3 for 20. Okay. Because it will be for 2 hours or maybe at least 1 hour if I'm going to take. So 3 for 20, 2 for 10. So we'll come in between the 15 minutes one. Okay. So 23 and 2 for 10. So right, we can take 15 minutes. 15 minutes break. By the time you come, it will be 20 minutes only. Yeah. So now it is 12:07, means 12:20, 12:10. So we are exactly meeting by 12:30. Yeah, I'm sorry, I forgot that one, Muthulakshmi. We are going very nicely. No problem. Your class is personal class. No, anytime we can sit. No problem at all. Yeah, that's okay. No worry. Yeah, no, I am very available. From morning 8 o'clock till night at 12 o'clock, I will be available. No problem. You have done a good job. No problem. I forgot, but I already gave a word that. No? Already given a word, so I cannot forego that one. I given you a word, no problem. But the thing is, we can decide our things. Okay. So 20 minutes, 15 minutes from now, 20 minutes, let us take. Yeah. So that's it. So Yes, dear students who are watching on the YouTube, this is a piece of information for you. If you are really interested in such sessions on a regular basis, please do contact me on +91 98 778 67360. I repeat, +91 98 778 67360. Contact me for subscriptions. Have a nice day. See you again in 20.